Why does the face float down with age? Most women think that it is inevitable. It is just gravity, old age, and nothing can be done about it. And they do not even think that it is actually possible to age beautifully. And even at 50 to 60 years old, you can look 30 years old. And for this, you just need to know the reasons why these age-related changes appear, why a double chin appears, why jowls appear, why the face as a whole flows down, and simply remove these reasons. So, today in this video, I will tell you about 7 non-obvious reasons related to the body. Why does the face actually creep down? And most importantly, as always, I will show you an exercise that will help prevent each of these reasons. And the first reason is the legs. You probably never thought about what they affect, but I can say that the largest muscles are in the legs. There is a lot of fluid here. And as an osteopath, I noticed that if there is tension in the legs, it negatively affects the posture and also negatively affects the face. Therefore, you always need to work in a comprehensive manner, and therefore, I strongly recommend doing leg exercises. You can squat, stretch your legs, and of course, work while standing. What can you do at home? Just lie down and lift your legs up and start shaking them. Just do this technique every day. You can also put your legs on the wall for 10 to 15 minutes so that the liquid flows down your legs. Because the liquid weighs down your legs and tension accumulates in the legs. All this then affects your posture, your neck, and even your face, and this is really true. What can you do? You can vibrate and alternate this with pulling your knees up to your chest. So inhale and pull them up as you exhale. Why? To stimulate the lymph so that the lymph from the legs, from the pelvis, rises up. To restore blood flow. When blood flow is restored, since the largest muscles are here, many different structures, then of course, it refreshes the face. It is not for nothing that they say that the legs are the second heart, and the next important area is the pelvis. In fact, I have noticed many times that women who have serious clamps in the pelvic area, not only do they have heavy legs, their legs swell. They can also have various problems with the internal organs of the pelvis. It can also be aggravated by operations. That is, if there was childbirth, if there were especially keratoses, scars, they form strong tension in this area, and literally here a knot is formed that pulls the body. That is, it worsens posture, the neck shortens, and the face begins to creep down. This is a direct connection, and perhaps many do not even know, but given that a lot of tension is concentrated here, it directly affects the face and pulls the face down. Just try to throw your head back. If you feel that when you throw your head back, everything here is taut like a drum, this is a bad sign. This means that the faces are really very taut here, and you need to work not only with your legs, but also with your pelvis. The simplest thing is to lie down in the butterfly pose. Spread your legs so that the ligaments stretch, so that the adductor muscles stretch. They attach to the pelvis, and they relax the pelvic floor. So, just lie down and relax. That is, you pull the navel up, knees in different directions, and breathe. Just inhale and exhale. What are you doing? You are gradually untying the knot here. Untie the knot here. Here, the face will also open up. It will straighten out. It will breathe. It really works. Therefore, I recommend simply putting your hands and starting to lift your navel up. Inhale and exhale. So, do 15 inhales and exhales, and then you will feel how it becomes easier here. Therefore, the pelvis directly affects ptosis, as do the legs. The next thing is the thoracic diaphragm. If the thoracic diaphragm is clamped, it is located here. Take a deep breath in and out. Feel how the diaphragm works. In fact, many women have a spasmodic diaphragm due to emotional stress experiences. Girls often breathe with the tops of the lungs, but the diaphragm does not work. This leads to the fact that the stomach begins to increase, a protruding belly appears, congestion appears, excess weight appears. And the whole point is that you need to stimulate the diaphragm in order to have normal blood flow, because all the vessels pass through the diaphragm. Therefore, first, learn diaphragmatic breathing. Take a deep breath in and out. That is, during diaphragmatic breathing, your ribs should be pushed out to the side. You can tap this area. That is, where the diaphragm is, you take a deep diaphragmatic breath and tap on the diaphragm. The point is that the diaphragm, if it is tense, can even lead to asymmetry. If the dome of the diaphragm on the right is tense, then the right side of the face floats down and the cheekbone drops, the ear drops. This is a direct relationship because in the body from the top of the head to the foot, everything is interconnected. The fourth reason is slouching, when the shoulders turn inward. And this is the position that you need to spread your shoulders, because then it will improve the venous edema from the head so that the face does not swell. You can simply lie down, turn to the side, lie on your side like this, and just stretch your arm to the side. Here, your pectoral muscles and shoulder are stretched, and just lie and rest, just like this for a few minutes a day on one side. Inhale and exhale and open your chest here. Then we also turn over and just move our arm back and relax. That is, it is imperative to work on posture. Of course, it depends on posture, because if your spine shortens with age, then your face floats down. And you can even observe and look at people in transport on the street. For everyone who has a short neck, who has a stooped spine, their face becomes more swollen and deformed. That is, the face begins to float. Therefore, stretch, open your posture, because then it will hold the frame of your face. And now we move on to the neck. That is, it is very important to watch your neck. Many women do not even realize how important it is. If your neck, well, shortens by at least 1 centimeter, it will negatively affect your face. The face will be 5 to 10 years older if the neck shortens a little. Therefore, stretch your neck and be sure to stretch the platysma. This is the muscle that goes here and is woven here. You can simply press the skin to the sternum, to the ribs, and simply make such circular movements. Stretch the crown of your head up and simply make such circular movements. We did it here. We just do circular movements like this so that the tissues stretch and everything straightens out here, right? That is, you can take it from both sides like this. In fact, in addition to physical reasons, there are other reasons associated with hormones, genetics, nutrition, many different processes, psychosomatics. Therefore, if you are interested in all this, I give more detailed materials about this there, and the link is below the video. Let's move on to the 6th physical reason. This is the skull. In fact, the skull with age, it kind of dries out. It becomes more rigid because the bones are also plastic. They are alive. They have liquid. They have organic substances. Due to this, they are alive and plastic. But with age, it begins to become rigid. Therefore, I recommend that you work with it. Yes, there are more serious techniques that I teach at the academy where we work with each bone, but I'm just showing you a simple grip. Grab the skull and start to pull the bones apart in different directions. Just rotate the scalp, the aponeurosis of the head, and there are many stitches here. By the way, again, if you are interested to look 5 years younger, join my rejuvenation course, and you will tighten your face and remove wrinkles. I teach all this. It is essential to work with the skull because it is also a very underestimated structure. Many work with muscles, with the spine, but the skull accumulates a lot of tension, so just at least massage it and it will give relief. This improves blood flow because many vessels that go to the face, they pass through the bones of the skull. A wine connoisseur passes. Therefore, if you massage the skull well, it tightens your face. I guarantee you, as an osteopath, I know how this works. And the 7th reason, of course, is swelling from stagnant lymph in the face. There is nothing worse when lymph accumulates. Always fight swelling. What can be done? Simply even a regular lymphatic drainage massage on the lymph outflow line goes from the center, goes to the periphery, to the ears and here, under the lower jaw. Therefore, we simply take it like this and squeeze out all the liquid to the periphery, to the ears. You can use a gua sha scraper. We simply take it and we move all the liquid to the ears and further down. That is, these are 7 such important zones that need to be worked with. These are the legs, these are the pelvis and abdomen, lifting the internal organs and relaxing this zone. This is the diaphragm zone. This is posture. This is neck stretching. This is working with the skull, and this is working directly with the face from the subcutaneous tissue of the face. I showed you the basic techniques, but they give an effect in the moment. And if you want to understand more deeply how it works, then join my rejuvenation program where we will work with face and body, and as a result, you will look 5 years younger.